What truly is the better goal for recovery? Final fusion or functional multiplicity? Let's get into it. So in this video, we will be covering the scientifically recommended recovery pathway for complex dissociative disorders. Also, stay tuned to the end where we discuss our personal opinions on the final fusion versus functional multiplicity dilemma. The recovery pathway that we will be covering here is the phase approach. This is discussed in more detail in the ISSTD treatment guidelines, which we will link down below if you want to learn more. The phase approach acknowledges that there is some level of pacing required when it comes to recovering from complex trauma. You can't just jump into the deep end with trauma processing if you aren't mentally prepared first. The first phase acknowledges this, as it is the safety and stabilization phase. It focuses on establishing a safe space, building your regulation skills, working on ways to improve communication between parts, and working on methods of harm reduction. It is the phase where you add all the tools that you're going to need to your toolbox before diving into trauma work. It also helps to try to build rapport with your therapist during this phase so that they are a safe person to process your trauma around. The therapist should be willing to refer to your alters however your system would prefer. The only caveat being that the alters in the system should acknowledge that you all exist in one body and that the actions of each individual alter in the system affects the other members of the system. This is pretty much just there to promote system accountability, which you can learn more about in our video on the topic up here. But this phase is focused on what can make you feel safe in the present moment. Now to phase 2. Phase 2 is typically focused on the most, as it is the phase where you work on trauma processing. Note that you probably won't be fully stable from the stability phase when you enter this phase. These phases are not linear, and you can go back to past phases if things come up in therapy that would benefit from that. These phases are placed in this order because of when they should start in the process of recovery, but they do not end when the next phase starts. It is also important that all the alters in the system have a voice in therapy when possible. While one alter may be in a safe and stabilized place for this phase, another one may not be. If an alter that isn't prepared for trauma processing is present during therapy, that's okay. It's important to take time to listen to them and their individual needs to feel safe enough to process the trauma that they hold. This is one case where going back to the first phase may be beneficial. Trauma processing can be different for everyone, as there are many different modalities for trauma processing, And different ones may work better or worse for different individuals or even for different alters within the same system. No one modality should be treated as the best one. Some common modalities used for trauma processing include eye movement desensitization and reprocessing, EMDR, which uses bilateral stimulation, which is switching sensory stimulation back and forth between both halves of the body. The version referenced in the name has you following something back and forth with your eyes. But other senses than vision also work for this, such as sounds switching which side they come from, or through touch, typically in the form of tapping, which can be something like this. Bilateral stimulation helps to keep you in a more relaxed state as you go back through your traumatic memories, desensitizing you to them so that you can go back and reprocess them in a way that isn't distressing. Another modality is trauma-focused cognitive behavioral therapy. Many will likely know what CBT is, as it is a very commonly used modality for a lot of things. At a basic level, it is about reworking your negative thought patterns so that your default thoughts work for you rather than against you. Exposure therapy may also be used, but it is not as common for recovering from the complexity of trauma that is present in complex dissociative disorders, as trauma responses tend to be more generalized, making it easier to form trauma responses to related stimuli to the one you are trying to expose yourself to, which can end up with more things triggering the trauma response rather than less. It's definitely something to be careful about, though it is also present in other modalities, like we mentioned earlier with EMDR, typically with more safeguards in place. Dialectical behavioral therapy is also a common one that you see used, which is similar to CBT, but more tailored around those who experience more intense emotions. Regardless of what modality is used, though, they will need to be tailored for dissociative responses. The therapist utilizing them should have some understanding of dissociation and how it may affect the application of the specific chosen therapy method. I think it is also important to note, since I know many without access to therapy may try applying these modalities to themselves, that you should never be trying to use any form of exposure therapy on yourself. Most do not understand how this therapy truly works. And as we stated earlier, it is very easy to end up with more and more generalized trauma responses if you don't know what you're doing. Other modalities, especially when it comes to talk therapies, may have some things you can pull from if you don't have access to therapy, but exposure therapy is not something you should ever be trying on your own. Now to the last phase, integration and rehabilitation. Integration is about increasing the cooperation between parts and reducing dissociative barriers. Integration does not require or even promote unnecessary fusion. Fusion is simply a single form of integration. Some systems may require fusion to reach an integrated state of functioning, but that by no means means that they all do or should be required to. Pushing for fusion is not what this phase is about. This phase is about memory sharing and improving functioning in day-to-day life. There are two commonly discussed forms of integration in the community. The first being final fusion, where all parts fuse into a single part, and the other being functional multiplicity, where multiple parts still exist separately and are able to work well together. Dissociative barriers being reduced to a degree where they aren't an encumbrance to day-to-day functioning, bringing alters closer together in functioning but not fusing them into a single part. Some fusion may still occur in the process of reaching functional multiplicity, just not the complete fusion of all of the alters. So, now that education time is done, let's move on to opinion time. Final fusion versus functional multiplicity. In our opinion, that isn't the right question to ask. Both are forms of integration, and integration is the goal of therapy, not a specific presentation of integration. It's also important to note that functional multiplicity is an important step in reaching final fusion. You can't just skip over the working together with your alters part. If your goal is final fusion solely because you want to get rid of your alters, potentially because you see them as some form of nuisance, I'm sorry to say that therapy is not going to work until you learn to get along with them or at least understand their perspective to some degree. And yes, even those alters. Fusion isn't going to naturally happen between two alters who hate each other and want nothing to do with each other. Another important part of this is that whether you reach final fusion or functional multiplicity in the process of integrating isn't always your choice. You may desire one over the other, and even work towards it. But the brain may naturally do the other without your say-so. Once you've reached an integrated state of functioning, your brain may make that choice for you, as far as what it thinks is best for functioning in day-to-day life. But most importantly, there is the question of if they are always different things. When talking to those who have reached functional multiplicity or final fusion, it is very common to notice a lot of similarities and overlap between the two experiences. Sometimes the difference boiling down to just interpretation of experiences. All the alters are still part of the fused whole, and you may still notice the differences in different alters' traits still being distinctly present in unique scenarios. And this goes back to what the theory of structural dissociation is talking about when it comes to integration. Full video on the theory linked up here. Integration isn't about parts going away. Even in those who don't form childhood trauma disorders and whose parts integrate at the usual age, these parts don't go away. They simply can seamlessly switch between each other without affecting identity or memory of events. The work and home selves is a way that these parts present in normal functioning. The fight or flight response is another. When integrated functioning is achieved, these parts and experiences are integrated into a singular whole experience with ease, but that doesn't mean the parts themselves aren't still present in integrated functioning. When you have spent your life with these parts being separate, having different names, identities, ways of behaving, and situations where they are already more likely to be present, that you are aware of, you are more likely to be able to notice the part's presence in day-to-day integrated functioning. That's why even if you reach a place where you are functioning in the same way as someone who never had the disorder, it still may be easy to see your parts as separate, which is how some, but not all, forms of functional multiplicity present. The line is simply very blurred between the two, and sometimes it can be up to your interpretation of experiences as to which one you are experiencing. So, for ourselves and our goals, we interpret functional multiplicity as simply a stepping stone to either outcome. We aren't setting our sights on the final goal, simply working towards functional multiplicity as one step on the journey, and allowing our brain to naturally do whatever it does whenever we reach that goal on the path. So I think that's all I plan to say on recovery. If you have any questions or want to talk about your personal perspectives on recovery or your personal recovery goals, you can leave that in the comments down below. We also have a Discord server linked in our description if you want to come chat with us there. It would be great if you liked the video if you liked it and subscribe to see more content like this. As we mentioned in our previous videos, we are nearing our first subscriber goal of 50 subscribers. It would be great if you could subscribe to help us reach this goal. Also, if you want to give input as to what we do as a celebration of reaching these goals, you can leave that in the comments down below or come and talk to us in the Discord server about it. And we also have a poll running on our channel with potential options to choose from if you want to go and vote on that. Right now, it's looking like potentially either a gaming live stream or a Q&A video. If you have any suggestions for games that you would like to see us play, you can leave that in any of the places we just mentioned. You can also leave any potential questions for a Q&A there. And we will also be linking a Google form in the description where you can leave questions. Whether or not we are able to do a full Q&A video will of course depend on how many questions that we get. But if you are looking for other videos to watch right now, you can check out our video on the differences between complex dissociative disorders up here. Or if you want to learn more about complex dissociative disorders in general, you can check out our playlist down here. I hope you're having a great day, and we'll see you in the next one.